Hello everyone, welcome to Patient Knowledge. I'm Dr. Kirmani and back with another video. I'd like to thank my viewers for their encouragement and support. Today's video is upon request from one of my viewers. This video is all about a lung disease called Chronic Obstructive Pulmonary Disease or COPD. So let's get started. Let's begin with describing the term. Chronic means persisting for a long time, obstructive means blockage, and pulmonary stands for lung. It's a slowly progressive disorder of the lungs in which the flow of air through the air passages is obstructed. Now there are two forms of COPD, chronic bronchitis and emphysema. Chronic bronchitis is the initial stages and it's a milder form of the disease where there is only mild inflammation and narrowing of the air passages, whereas emphysema is a more serious form of the illness. And in emphysema, the lung tissue loses its elasticity. Well, it's more common in women than men, and it is predicted that by 2030, it will be the fourth leading cause of death. For a better understanding, let's look at the structure and function of lungs. Lungs are a pair of spongy structures that are present behind the rib cage in the chest. The left lung is slightly smaller than the right one and it is divided into two sections or lobes, whereas the right lung is slightly bigger and has three lobes. The lungs are protected by a covering or membrane called pleura. Now there's a tube called windpipe or trachea that passes through the throat and it divides into two branches called bronchi, left and right bronchi. These open up into the lungs and branches out into small air passages called bronchioles. Now, there are millions of small air sacs or pockets present on the surface of lungs called alveoli. They resemble raspberries or bunches of grapes and are responsible for gases exchange. Let's look at the breathing mechanism. Now, when you breathe in air through your nose or mouth, this air passes through the windpipe or the trachea and it reaches the lungs. The alveoli extracts oxygen from this air and it releases this into the circulation and also takes up the carbon dioxide from the circulation and it exhales it out. So the gases exchange takes place with the help of the alveoli. What are the causes of COPD? Most of the people with COPD have been found to be smoking 20 cigarettes per day for more than 20 years. So smoking is the leading cause. Old age can also sometimes cause this condition. Air pollution. When people are exposed to industrial fumes and dust, they may develop this problem. And genetic factors also play a role and sometimes are responsible for this condition. Let's see how cigarettes affect lungs. About 80 to 90% of inhaled smoke remains in the lungs and this causes irritation and excessive mucus production and damages the deep parts of the lungs. Eventually, mucus and tar clog up these air tubes and they cause chronic bronchitis and COPD. Now, this persistent inflammation or swelling and irritation of these air passages may thicken and damage their delicate lining, and this results in narrowing of these tubes. What are the symptoms? People with COPD complain of morning cough with sputum. They develop shortness of breath with exertion, which gets worse with time. They have noisy breathing or wheezing. They feel tired, weak, and most of them have difficulty clearing chest. What are the risks of COPD? People with COPD are prone to chest infections since their lungs are compromised. They can get pneumonia, They can develop heart failure and respiratory failure as the COPD gets worse with time. Since it involves breathing, people with COPD may have a lot of anxiety, panic attack, and depression associated with this. Now you must be wondering, how is it diagnosed? There's a simple test called lung function test or spirometry, which helps to diagnose this condition. Now it's very easy. You're asked to blow through a pipe as hard and as long as possible, and this is recorded in the machine. It gives an idea about how much air is exhaled out of the lungs and will help to find out if there is any lung function impairment, and also helps in grading the disease, whether it is mild, moderate, or severe impairment. So this helps the doctor to formulate a management plan. Now, what's the treatment of COPD? Self-management is the most important thing in treating COPD. And this can be achieved by making lifestyle changes such as stop smoking, go for walks in clean fresh air. Keeping physically active is good for both lungs and heart. People must get adequate rest. Those with COPD must avoid places with polluted air, irritants such as smoke, dust, and paint fumes. And they must avoid contact with people who have colds and flu. Now, what about the medical help? One must visit doctor regularly if they have problems of breathing. Well, oxygen may be required in some cases, and home oxygen units can be easily installed. Visit your doctor without delay if you get a cold or bronchitis or start coughing up sputum. If you have chest infection, antibiotics will help clear it. Now, what's the medication and prevention? The medication part has two types of medicines that usually help in improving breathing. One is bronchodilators and the other is corticosteroids. Bronchodilators provide short-term relief by opening up the narrow air passages and thus improving the breathing. Corticosteroids can be taken orally or inhaled, and this also helps in improving breathing. People with COPD are usually advised to take influenza injection yearly in autumn, pneumococcal vaccine every 4 years, and quit smoking. Now, if you have signs and symptoms of lung disease, even if you're not a smoker, you must see the doctor. Well, that comes to the end of my video. Thanks for listening. And if you like this video, don't forget to like and subscribe to my channel. I'd love to hear any suggestions on what you might like to know more about. Bye for now.